Hey, what's up everybody? Welcome back to the channel. Today we're diving into the world of NSAIDs, those over-the-counter meds you probably have in your medicine cabinet right now. You know them as ibuprofen, naproxen, maybe even aspirin. NSAID stands for non-steroidal anti-inflammatory drug. These medications are your go-to for tackling pain, bringing down fevers, and reducing inflammation. We're going to break down the top 10 NSAIDs, talk about their uses, and give you the lowdown on how they can help you. So, if you're ready to become an NSAID expert, stick around, hit that subscribe button, and let's get started. First up, let's talk about ibuprofen, the MVP of the NSAID world. You know it by its brand names like Advil and Motrin. Whether you've got a headache, achy muscles, or menstrual cramps, ibuprofen is there for you. How does ibuprofen work its magic? It blocks chemicals called prostaglandins. These messengers tell your body to feel pain and inflammation. Ibuprofen steps in and says, nope, not today, giving you sweet relief. It's also great at bringing down fevers, generally safe for most people when used as directed. But check with your doctor if you have health conditions. Remember, it's for short-term relief. Ibuprofen, the all-star NSAID for pain and fever. Next up on our NSAID journey we have Naproxen, the long-distance runner of pain relief. You might know it better by its brand names, Aleve and Naproxen. Naproxen provides relief for up to 12 hours. It's great for arthritis, muscle aches, or menstrual cramps. Like ibuprofen, it targets pain-signaling prostaglandins. Naproxen is more potent and lasts longer than ibuprofen. You can take it less frequently for extended relief, but it may increase the risk of stomach upset or heartburn. Follow the dosage on the label and consult your doctor if needed. Naproxen helps you power through your day, even with pain. Let's now talk about the OG of pain relievers, the one that's been around for ages, aspirin. You know, that little white pill that's been a staple in medicine cabinets for generations? Well, aspirin is more than just a pain reliever, it's got a heart-healthy side too. It's been used for centuries to relieve headaches, toothaches, and all sorts of aches and pains. And while it might not be as strong as some of the other NSAIDs on our list, it's still a reliable option for mild to moderate pain. It also has blood-thinning properties, which means it can help prevent blood clots from forming. That's why doctors often recommend low-dose aspirin for people at risk of heart attacks and strokes. Aspirin can increase the risk of bleeding, especially in people with certain medical conditions or those taking blood thinners, so there you have it. Aspirin, the OG pain reliever with a heart-healthy twist. Moving on to Diclofenac, a powerful NSAID that packs a punch against pain and inflammation. You might recognize it by its brand names, Voltaren, Cambia, and Cataflam, among others. Diclofenac is often prescribed for conditions like arthritis, sprains, strains, and other injuries that cause pain and inflammation. Like the other NSAIDs we've talked about, Diclofenac works by inhibiting those pesky prostaglandins. Diclofenac is available in different forms, like tablets, capsules, topical gels, and even eye drops, making it a versatile option for various types of pain. The topical gel form of Diclofenac is particularly useful for localized pain, like that nagging pain in your knee or back. However, it's important to note that Diclofenac, especially in its oral form, can have a higher risk of gastrointestinal side effects compared to some other NSAIDs. So, there you have it. Diclofenac, the targeted NSAID that can provide relief for a wide range of pain and inflammatory conditions. Up next, we have Celecoxib, an NSAID that's often prescribed for long-term management of pain and inflammation. You might know it by its brand name, Celebrex. Celecoxib is often prescribed for chronic conditions like osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis, providing sustained relief from pain and inflammation. Now, Celecoxib works similarly to other NSAIDs by inhibiting prostaglandin production. However, it's considered a COX-2 inhibitor, which means it specifically targets the COX-2 enzyme involved in inflammation. This targeted approach is thought to potentially reduce the risk of certain gastrointestinal side effects associated with some other NSAIDs. However, it's important to note that Celecoxib can still have potential side effects, and it's essential to discuss its suitability with your doctor. So, there you have it. Celecoxib, the long-term NSAID that can help manage pain and inflammation associated with chronic conditions. Let's talk about Indomethacin, a potent NSAID that's often prescribed for moderate to severe pain and inflammation. You might come across its brand names, Indocin and Tiverbex. Indomethacin is often used to treat conditions like gout, ankylosing spondylitis, osteoarthritis, and rheumatoid arthritis, providing relief from pain, swelling, and stiffness. Indomethacin works similarly to other NSAIDs by inhibiting prostaglandin production. While indomethacin can be highly effective, it's important to note that it can also have a higher risk of side effects compared to some other NSAIDs, particularly gastrointestinal issues. That's why it's crucial to take it with food, follow the recommended dosage, and discuss its suitability with your doctor. So there you have it. Indomethacin, the potent NSAID that can provide relief for moderate to severe pain and inflammation. Now let's dive into Meloxicam, an NSAID that's commonly prescribed for osteoarthritis pain. You might recognize it by its brand names Mobic and Vivlodex. Meloxicam is specifically designed to target pain and inflammation associated with osteoarthritis, a condition that affects millions of people worldwide. Like other NSAIDs, Meloxicam works by inhibiting prostaglandin production. However, it's considered a preferential COX-2 inhibitor, meaning it primarily targets the COX-2 enzyme involved in inflammation, while having a lower impact on the COX-1 enzyme, which is important for protecting the stomach lining. However, it's important to note that Meloxicam can still have potential side effects, and it's essential to discuss its suitability with your doctor. So there you have it, Meloxicam, the NSAID that can help you stay active and enjoy life to the fullest, even with osteoarthritis. Let's now explore Ketoprofen, a versatile NSAID that's used for a variety of pain and inflammatory conditions. You might come across its brand names, Oruvail and Orudis. Ketoprofen is used to treat a wide range of conditions including arthritis, menstrual cramps, muscle aches, and pain after surgery or dental procedures. Like other NSAIDs, Ketoprofen works by inhibiting prostaglandin production. It's available in various forms including tablets, capsules, extended-release capsules, and topical gels, making it a versatile option for different types of pain. However, it's important to note that Ketoprofen, especially in its oral form, can have a higher risk of gastrointestinal side effects compared to some other NSAIDs. That's why it's crucial to take it with food, follow the recommended dosage, and discuss its suitability with your doctor. So there you have it. Ketoprofen, the multi-purpose NSAID that can provide relief for a wide range of pain and inflammatory conditions. Moving on to Peroxycam, an NSAID that's often prescribed for long-term management of chronic pain and inflammation. You might find it under its brand name Feldene. Peroxycam is often prescribed for conditions like rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis, providing sustained relief from pain, stiffness, and swelling. Like other NSAIDs, Peroxycam works by inhibiting prostaglandin production. However, it's known for its long half-life, which means it stays in your system longer, allowing for once-daily dosing. While this long duration of action can be beneficial for some people, it's important to note that it can also increase the risk of side effects, particularly gastrointestinal issues. So there you have it. Peroxycam, the long-acting NSAID that can provide sustained relief for chronic pain and inflammation. Finally, let's talk about Aalac, an NSAID that's commonly prescribed for managing pain and inflammation in conditions like osteoarthritis and rheumatoid arthritis. You might come across its brand name, Lodine. Aalac is designed to provide relief from pain, stiffness, and swelling associated with arthritis, helping people manage their condition and maintain their quality of life. Like other NSAIDs, Aalac works by inhibiting prostaglandin production. While Aalac can be effective in managing arthritis pain, it's important to note that it can also have potential side effects, particularly gastrointestinal issues. That's why it's crucial to take it with food, follow the recommended dosage, and discuss its suitability with your doctor. So, there you have it. Aalac, the NSAID that can help you manage arthritis pain and inflammation, allowing you to stay active and engaged in life. That's it for our deep dive into the world of NSAIDs. We've covered the top 10 NSAIDs, from the familiar faces like ibuprofen and aspirin to the more specialized options like celecoxib and Peroxycam. Remember, NSAIDs can be powerful allies in the fight against pain and inflammation, but it's crucial to use them responsibly and under the guidance of a healthcare professional. Always follow the recommended dosage, be mindful of potential side effects, and don't hesitate to reach out to your doctor if you have any concerns. Now I want to hear from you. Which NSAID do you find most effective? Have you tried any of the ones we discussed today? Share your experiences and questions in the comments below. Don't forget to give this video a thumbs up, subscribe to the channel for more informative content, and I'll see you in the next one.